Peace be to you all. AsSalama'laikum. This is Epidemic, physician assistant and health educator. So, doing my YouTube video for PA Day, or PA Week rather. So happy PA Week. I think this is day number 3. But I thought I would talk about what it is to be a healthcare provider, specifically what we call collectively an advanced practitioner. So collectively nurse practitioners and physician assistants, and then some doctors include themselves in that term also. But it's an advanced clinician in this day of COVID-19, this era, this pandemic. It's really interesting because it reminds me of the days of HIV/AIDS, and I don't use those two terms. I try not to use those two terms interchangeably because one's based on something called the CD4 count or T cell count, for those of you all that may be familiar with those terms. But I remember working with in the healthcare field back in the early, or maybe the late 80s as a lab technician, but then the early 90s, like 1990, as a nursing assistant, and I had my first HIV patient, or this patient actually had AIDS, and back then, there was a lot of ignorance about HIV and AIDS, and people acted accordingly based upon their ignorance, just lack of knowledge, but also the pejorative use of the term ignorance, just being stupid. Like, well, look at that guy. He's skinny. He's been losing weight, so he must have that AIDS disease, that gay disease. In fact, back in the late 80s, I did my doctoral dissertation on HIV medicine, and it used to be called GERD, so gay, or GRID rather, gay-related infectious disease, and it was quickly changed to acquired immune deficiency syndrome. But there was a lot of lack of knowledge about the disease. People thought that things like, well, could you get it from touching somebody with it? If you shared utensils with somebody who had AIDS, could you get it? A mosquito bit you and then bit somebody with AIDS, then bit you. Could you get it that way? It was, people were fired. I mean, I knew people who were, it was very devastating on their lives. And you look back at that time and you cringe, and it became a politicized issue. And that really segues to now with this COVID-19. Here we have another virus, as far as we know, it's a virus. And it's been politicized. People who have it get kind of bounced around of like, well, be careful of that person, because they were coughing and sneezing. Even there were some jokes at the places where I frequent. So my job and just being in going shopping, you'd see somebody sneezing and coughing, and they'd be like, "Oh my God, that guy could have COVID. Get him out of here." Because we still don't know exactly how the disease is spread, and there's a lot of conspiracy theories out there, just like with HIV/AIDS. And I say this as a black man because first I was looking at these YouTube videos that were saying, this is the black man, this is the white man's time has come, because y'all notice that black folks ain't dying from this disease. You know, these like, you know, Black Power brothers on YouTube. And then black folks, it was found that black folks were actually dying at higher rates from COVID-19 than other groups. And it was like, okay, well, they created this disease to wipe out the black man. They tried to get us with syphilis, then they tried to get us with AIDS, and now they're trying to get us with COVID. You know, so you're hearing all of this stuff. And how do you sift through all this information and misinformation? And when you have ignorance, in this sense, I'm using actual lack of knowledge, you know, people err on the side of caution because nobody wants to die. And that caution often leads to fear, and then the fear leads to anger. So people are accusing each other of spreading it or not taking it seriously enough. And you know, I am really sick and tired. I say this, it's going to tick some people off. I don't care. I'm here. I'm taking care of people who have had COVID. I've had family members with it. I don't care what political party wins, whether Republicans, Democrats, Independents, Green Party, Emoji Party. I want what's best for people in terms of their health care. You know, I want people to get tested. If they're positive, I want them to be able to get treatment for it, whatever that treatment happens to be. I want preventative care for it. If it's going to be in the form of a vaccine or a pill, you know, that has yet to be seen. I can tell you as somebody who actually was a coordinator on major clinical trials during my sojourn into the healthcare field, through the healthcare field. You can't rush things. You know, we have, you know, you've got to do inclusion and exclusion criteria, and you know, reactions during the trials, and post-trial reactions months out, then longitudinal data years out. You know, so it's nothing to rush. But then also, you know, time is you know, we don't have a lot of time to not come up with a treatment or a preventable measure, because it is killing people. But I'll say this, that it's more people have lived who have acquired this disease than have died. You know, many more people, and it's going back to HIV. You know, I think as I started back in HIV medicine 20 years ago, I saw people dying that were still dying in the beginning, like 20 years ago, that were either not taking medication because, or not getting tested at all, and not taking medication through that way. So by the time we get them, they had like hardly any CD4 count, and they would die of AIDS. But as time progressed, I saw less and less of that, to the point where it was, you know, I've got patients that still contact me and say, look, I'm doing great, you know, I'm working out, you know, some have even gone on to have families. So I think, I don't know if you can actually compare the two diseases, but I think you can compare the paradigm and maybe the thought process and some of the impact that it has had on society. I think that this COVID-19 has been a lot more impactful in terms of being invasive into our personal lives. Like, you know, do you have to wear the mask? You know, businesses can keep you out of their place of business if you don't have a mask. You know, there's people who are protesting and not wearing masks. So you've got maskers on one side and non-maskers on the other. But it's just been an interesting time to practice as a clinician. So I just wanted to share those thoughts with you guys. But But I wish you guys the best of your success in your positive endeavors. I think God willing, we'll get through this, inshallah. Take care. Peace.